So continuing with Ketorolac. Ketorolac has onset of action again somewhere about 10 to 30 minutes. Similar to other NSAIDs, this also have the same thing. Its peak value reaches somewhere around 1 to 3 hours, and total duration of action lasts somewhere around 4 to 6 hours, right? So the main thing that we need to remember about most of the NSAID is that onset of action, how fast it acts, and till how much time it will have it effect in the body, right? So this was about the onset of action, peak, and duration of action. Next is at what amount, right, it will cause a GI bleed, right? So GI bleed occurs somewhere around, if you give like more than or equals to 40 mg per day. So it is actually so less, right? And overall dosage, right, if we talk about that, so dosage is somewhere around like 10 mg every 4 to 6 hours. There is about 24 hours, right? So about 4 times 10 is about 40 mg per day is the max dose you should give, right? So max dose is 40 grams per day, and beyond that there will be a high risk to cause the GI bleed. Also because of its property, right? Let me tell you about its property. The Ketorolac was a very nicest, like among the whole batch of NSAID, right? This 1, 2, 3, and 4, nobody has this 4 upward arrows, right, which depict very high powered analgesic. It's again not opioids, it will not cause the drowsiness and the depression of respiratory centers and so on. But among the NSAID group, among the this ladder, right, that we have already discussed about the NSAID, that whenever in the NSAID ladder, right, we start with the NSAID, then we switch to like low dose opioids, and then at like stage 3 and stage 4 we start to use the high dose opioids to relieve the pain. However, in this case you can use Ketorolac because it has a very good analgesic coverage. It is not that good antipyretic, and is not again that good anti-inflammatory. It doesn't have that good anti-inflammatory effect. However, we need to pay this price of this analgesic effect with the gastric bleeding, right? So Ketorolac has overall very high analgesic, and among the whole community of the NSAID, it is also have one of the most highest occurrence of gastric bleeding. So we have to just make sure that we just prescribe it very cautiously. So for the Ketorolac, it was again most ulcerogenic because we have already discussed that, and it is highly nephrotoxic, right? So it was very good. It was very good analgesic that you can use to relieve pain. However, remember that you should not exceed this 40 milligram per day, and even if you have to use this, do not use it for more than or equals to 5 days. It will be use only for less than 5 days. Beyond that will be have a very high risk to cause the GI bleed, right? And let's talk about its indication. In the indications, for the indication, it is used for severe pain, right? Like the most severe pain, and still you don't want to sedate the patient, you can use Ketorolac. It is most commonly used by dentists actually, especially after the root canal treatment, right? They will prescribe this ketorolac in different forms, right? And you can also use it like after post-operative conditions, post-operative pain, you can use ketorolac, right? So this was all about the indications of ketorolac. Now let's talk about some combination. However, they are not that much necessary. All you need to know is that 40 milligram is the maximum you can go in a day. It is available in different format, right? You can have the 10 milligram tablet. It can also be like 20 milligram tablet, depending upon which company you are preferring, right? Then you can also use it in like eye drops. It is also available in eye drops. For example, there is some sort of infection, there is so much pain, you can use some sort of antibiotic along with the ketorolac. It will be very nice thing, and it will be again helpful. But again, antibiotic and ketorolac doesn't have any anti-inflammatory effect, right? It is very mild, so not that commonly used. We use some other combinations for eye drops, right? Because in case of infection, there will be always inflammation, which ketorolac actually fails to provide, right? Right, so let's talk about some combination. First is ketorolac plus ofloxacin in case of like eye infection, because this combination of ketorolac and ofloxacin doesn't cover inflammation, so we discovered another one, ketorolac plus dexamethasone. Very good steroid, right? Then ketorolac ofloxacin, there's also ketorolac moxifloxacin, again for the same eye condition, ketorolac plus phenylephrine, right? We can use to decrease the inflammation a little bit, right? So these are the main stuff we can use. The dosage is again available in 10 milligrams you can use, and maximum you can go for like 4 tablets in a day. And you should keep in mind that don't use ketorolac like just for fun. It is a very potent, however it will also cause a GI bleed also very severely, so use ketorolac cautiously. So this was all about the ketorolac. Next we will talk about let's say which one should we talk about? So we are done with aspirin, ibuprofen, naproxen, ketorolac, mefenamic acid. Let's talk about indomethacin. It is really very important drug, indomethacin. I'll tell you some usage in the fetal life, how we use it for the PDA, right? So let's talk about the indomethacin in the another lecture.